Good afternoon, and welcome to Imaging Interoperability, Connecting Disparate Images from Across the Enterprise, a webinar tweet chat combo from healthsystemcio.com, sponsored by GE Healthcare. Just a little housekeeping before we get started. My name's Anthony Guerra, and I'm the Editor-in-Chief of Health Systems CIO, and I will be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our Managing Editor and Director of Social Media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can view the tweet chat in the Media Viewer panel on the right-hand side of your screen. We'll also be using the Q&A panel today, so please type your questions in as they occur to you and send them to all panelists, and we'll take them later in the program. And you could download the deck by using the URL on your screen, and it's at the bottom of our slides, and it's been sent out in the chat box. So, just so you see how we are going to spend our time today, first we're going to have our featured panel discussion with Andy Strickland, Director of Imaging Informatics with the University of Washington Medicine, Brandon Taggart, Owner and Principal Consultant with Confetti Healthcare IT Consulting, and Aaron Hillman, Director of Global Product Marketing with GE Healthcare Digital. So, without any further delay, let's jump right into our conversation. We've got a lot to discuss today. Andy, let's start with you. Can you give us an overview of your organization and your role?
Good morning. I'd be happy to. So, obviously, we're academic. We're an affiliation of 5 inpatient facilities, including Seattle Cancer Care Alliance, which is predominantly outpatient but has some hospital beds as well. We also have several outpatient clinics. We're located in Seattle, Washington, and service that community, obviously, but also we serve 5 northwestern states, including Alaska. We do about 600,000 radiology exams per year.
Excellent. Thank you, Andy. Brandon?
Hi, my name is Brandon Taggart. I am the owner and principal consultant of Confetti Healthcare IT Consulting. We primarily focus on healthcare IT advisory and expertise specifically within enterprise imaging. We're a small group focused really on providing the full life cycle throughout projects, from whether that be a strategic initiative or a tactical initiative. We have resources to assist you with your goals, and I'm just really looking forward to the questions coming from the group.
Very good. Aaron?
Thank you, Anthony. My name is Aaron Hillman. I'm the Director of Global Product Marketing at GE Healthcare for our vendor-neutral archive and enterprise imaging analytics solutions. On behalf of Andy, Brandon, myself, Health Systems CIO, and all of GE Healthcare, thanks so much, everybody, for joining us today. We're looking forward to this conversation with you.
All right, very good. Let's jump right into the meat of it. In your current state, tell us how the VNA helps with the following, and let's start with clinician and end user compliance. So we're going to take these one at a time. And Andy, why don't you start us off with your thoughts around clinician and end user compliance?
Sure. I think the main point here to make is just that there's a lot of things the VNA does for us, but one of the things that I think is clear is that there is imaging being done virtually everywhere in a healthcare organization today. We were actually very surprised to see just how much of it is going on. Most of it, I would say, is probably ultrasound, and also there's a fair amount of digital photography being done for a variety of reasons. So with all of this activity going on, at a kind of a CIO hospital level, it's very difficult to keep all this managed in a good way. So a lot of these departments don't have a well-managed archive. Some don't have, in fact, probably most don't have an archive at all. And something that most of them want but don't always have, in fact, usually don't have, is just a web viewer to be able to see the images that they're capturing, and then to ideally integrate that web viewer with the EMRs that are in use. So they're not even able to see their own images in many cases, and certainly aren't able to share those images with other departments. So one of the things the VNA does for us is creates a well-managed repository that has those features I mentioned in it, and provides everybody to participate in that without having to have a lot of additional costs that they have to bear.
Very good. Brandon, your thoughts on the clinician and end user compliance aspects?
I think I have a slightly different perspective, just based off of my involvement with different clients. I think clinician end user compliance usually makes me think of the multitude of liabilities that imaging systems can produce. I mean, we expect that our administrators and our analysts of systems would catch all of the potential pitfalls, but the fact of the matter is, especially when dealing with disparate systems, it creates a lot of opportunity for scenarios that we're not even aware of. When you move towards consolidation, like a VNA, you have consolidated audit trails for understanding who's accessing the data, understanding in terms of end user compliance, in terms of clinician compliance. There's other things of knowing that there might be a canceled order out there with appropriate, an exposed patient that had a study completed even though the order was canceled, yet no report exists. That creates a liability situation for the entire organization. So those are some just examples of some key areas that you really need to watch out for, and a VNA helps with identifying those areas.
All right, very good. Brandon, let's stick with you and go to the second point, IT governance and interoperability across your organization. How does it help with that?
Governance, I can't stress this enough. Governance is key. If the organization does not have involvement from the highest echelons of leadership, and I'm talking CIO level, possibly above, in terms of being involved in the project from the get-go, you're going to see some issues in terms of not understanding the true strategic direction or business cases that you're trying to accomplish. So governance is really the foundation of starting your project.
All right, very good. Andy, thoughts around governance and interoperability?
I think that Brandon has a more useful perspective on this than I do, because really my perspective is coming from that of a single institution and what we've done with it. When we started using VNA, it was about 5 years ago, I guess, and at that time, there really weren't a lot of good examples out there that we could draw from in terms of even really what an enterprise imaging program would look like and what the issues were likely to be and what kinds of things we needed to govern. So, when I envision myself trying to pull together a bunch of hospital execs with both clinical and IT backgrounds and have a conversation about creating the parameters for the program, we wouldn't have known what to talk about. I think that today that would be different. At the time, that's kind of how we felt. So we kind of did this as sort of a guerrilla program. I think that, in retrospect, and at this point, I think it's time for us to really create some governance for it. I absolutely agree with Brandon on that. We weren't able to really pull that together at the time. I think now it's something we really have to do.
Hey, this is Darren, if I might interject for a moment. This is sort of, as Brandon said so well, this is one of the true benefits of a VNA, right, is providing you that opportunity to really look at your enterprise imaging strategy and how it allows you to deploy that across the organization in its entirety and across multiple types of users. As mentioned in the previous comments around clinician and end user compliance as well as sponsorship, I think the sponsorship to implement the governance is one of those first steps. And as GE Healthcare, the organization, as we look at how we talk through this with many different types of healthcare organizations across the country and the globe, the conversations actually tend to be pretty similar, which is remarkable in terms of where they're finding that they're disconnected, and one of Andy's comments where where they're seeing a huge amount of information being gathered that they had no idea was out there. So it's a great time to look at that organizational structure and how to roll this out.
Okay, very good. Aaron, let's stick with you for the third point here, data auditing and actionable understanding with analytics. What are your thoughts around that?
Sure. So it's a really interesting time in healthcare, right? And we have a lot of burgeoning, let's call it spirits of artificial intelligence, business intelligence, and what the next steps will be in terms of how all of this data is visualized and understood, right? And the ultimate goal is to provide organizations like University of Washington with a view to how their data is being used, how it can affect their operational, clinical, and financial outcomes, and how they can affect change in a very meaningful and immediate way. So by aggregating the data and the DNA to start, it provides a single source of information with which to extract data. So as solutions are developed and improved, I think that what we'll see is more or deeper understanding for those departments and organizations.
Very good. Andy, thoughts on bullet point 3 here about data auditing?
Well, it's one of the things that you can do centrally that would be difficult to do any other way. I think that, again, having DNA and the systems that go with that, it certainly gives you a way of doing it. I think one of the interesting challenges that we have is data quality. It is truly an uphill battle, and it seems like every new clinical area that you visit, you're starting over again. They don't have workflows that lend themselves to good, clean data. They may not have equipment that supports it. They don't have a culture of it in terms of imaging. I'm sure that they're, great with data quality in other respects, but when it comes to imaging, this is a new area for them, and they don't really have that kind of discipline as part of the way they do things. So you come in to a department as a service, and you find yourself not only providing a tool, but also kind of preaching the value of data quality and consistent workflow, policy, procedure, that kind of stuff. So we struggle with it a lot, but the good news is that you're imposing discipline, but you're also offering things. And so you can say, well, I need you to do these things that are kind of difficult, but on the other side, I can offer you these benefits that come from that, and hopefully it's a package that is acceptable as a whole.
Very good. Excellent. Brandon?
To follow Andy's point, we're very data rich and information poor in so many organizations, and analytics has been a buzzword, obviously, for quite a bit of time. Unfortunately, I feel like a lot of organizations I've worked with, they've gone forward with putting certain solutions in place, but not really understanding what that data means or how to use it. And when we talk about actionable data, there are definitely a lot of solutions out there today that do a phenomenal job of not only providing you analytics from a system standpoint, but also putting the financials to it as well. And that's really key, because if you don't understand your metrics in context to your financials, you really don't have a lot there. You may pick out some pitfalls, but you're not going to have the full 360-degree perspective that you really need.
All right, very good. Andy, let's go with you on the next question. Tell us how you think about organizational structure, preparedness, and pitfalls during an implementation. What's the project life cycle order?
Well, I think for us, again, the biggest pitfall for us, the biggest challenge was the fact that we had really didn't have very good vision at the outset. We had some very specific needs we needed to fulfill. We had a general sense that, or feeling that the VA might be helpful beyond what we already knew it to be. People were saying it's going to be the next big thing, and you can stuff all this information into it. We didn't really have a good feel for what that information was going to be, who our users were going to be, So I just think lack of understanding of what we were really getting ourselves into. So that was probably one of the biggest challenges that we faced at the beginning. And then similarly, when you look at, how does hospital administration ultimately is going to have to help pay for this thing and provide the governance we talked about, but also the financial support. How do you get them on board with something if they don't really understand what it means? And clearly that understanding is growing and developing over time, and it seems to be happening fairly rapidly. I think, still, I don't sense that our leadership fully appreciates what this can do for them. And so I think we kind of have to we have a chicken and egg situation where we need to produce some tangible evidence that this thing is clinically relevant and financially supportable before we're going to get the support that we need from leadership. And I think we're just in a tipping point right now where we're starting to show some real evidence of those things. Not as much as I would like, but certainly some evidence, and ready to go to leadership and say, hey, look, this is really worth backing. This is an important part of healthcare delivery today, and we want you to really get on board.
Excellent. Brandon?
So if we're talking about organizational structure, to what Andy said, I mean, it goes back to governance and preparedness of making sure you have the appropriate team to approach any kind of implementation. In terms of preparedness, pitfalls during an implementation, there are so many avenues we can go down here in terms of mistakes that have been made.
A lot of pitfalls, huh?
Yeah, but I think I'd like to simplify it and say, some of the things that we could do to maybe limit some of those items, because we're going to have them regardless. Even the most prepared team's going to still have some pitfalls. But I would say really approach a project for focusing on the most complicated items first prior to making some further strategic decisions. And what I mean by that is let's take, for instance, data migration. Data migration has been an Achilles heel for most organizations that take upon an enterprise imaging project. It's always underestimated how long it's going to take, and it ends up, whatever timeline you're given, double it. That's most likely what it's going to be. Right. So I'll give that one as an example, but definitely focus on your key areas, and if it looks like something that's going to be difficult, do it first. In terms of project lifecycle order, we could talk about basic project management methodology, but I don't think that's what this question is pointing at. From a lifecycle order, when I look at a project, you really want to start with business case, a charter, understanding exactly why you're doing something. Exactly what Andy stated is trying to get towards what is the financial benefit? Is there an ROI? A lot of times with IT initiatives, there is not an ROI. There may be a qualitative ROI, but not necessarily a quantitative one. In terms of governance, that obviously comes right around the same time, making sure that's clearly established and everyone's roles within the project. Then moving into an actual discovery and assessment of looking at what you really have, what you can utilize into the future, and what just downright needs to be replaced. And making sure you're looking at both the clinical and the technical components associated with that. Then you're moving in your RFP or your RFI, depending on time constraints. Contract negotiations, which are key. Never shortchange yourself on contract negotiations. Make sure everything has been line itemed. And then moving into your implementation. And then once you've moved into your implementation, you're still going to have some scope creep, and expect it, because that happens with every project. Just try to limit it. Otherwise, your go live date is going to continually move on you, and you really want to avoid that from happening. And then don't forget, one of the most important things that's sometimes forgotten is post go live optimization, and making sure to focus on that after the fact.
Very good. Aaron?
Yeah, so hard to improve on those two answers, but But the thing that I think is important that also is very frequently forgotten is your stakeholders. I really like what Brandon said about both the clinical and the IT or technical. Those are critical, and it's important to remember that the people that are going to be really benefiting from this are your clinical end users and the patients. What this does is the VNA provides a foundation to consolidate that holistic patient imaging record along with all of their other, relevant metadata that goes along with it. So by making sure that you include stakeholders from those departments that you want to strategically include from the start or all of them or however you want to lay out your enterprise imaging strategy, make sure you have stakeholders to get that buy-in, because if they are bought into the implementation and design process, they'll be bought into the using of it as well, and that goes a long way to the success of a project.
Very good. Very good. All right, Brandon, let's start with you on this question. What are some best practices in rolling out the VNA to other departments in XDS in light of the challenges we just covered?
So best practices in terms of rolling out VNA, again, as I stated, start with your data migration. Even if you haven't selected a VNA vendor yet, you may want to be staging your data already, ensuring that you have the cleanest form of data prior to moving it to your VNA target. Beyond that, you need to understand first what kind of VNA do you need. Not all VNAs are created equal, and there's kind of a pick list in terms of the functionalities that you're going to receive with your VNA. The other thing you need to know is, what is your roadmap? Do you have future implications where you may need certain functionalities from your VNA in the future? What specialties do you plan to tie or stack on top of your VNA? Because there's a lot of integration components that you need to be very aware of with regard to a VNA. And again, I make this statement clear as possible. Not all VNAs are created equal. So you need to understand what the limitations might be there before you move forward. In terms of XDS, XDS is it's kind of a touchy subject, because XDS is, and one of my colleagues uses this statement all the time, XDS is like a fax machine. If you have it and someone else has it, it's wonderful. If you have it and no one else has it, it does you no good, really. I mean, it does you some good, but there's other ways to accomplish the same goals. So with that said, depending on your organization's challenges or desires in terms of how you want to capture visible light and the programs associated with that, XDS may be the right option. The other option, you could do some DICOM wrapping, but those are decisions that I think need to be looked at case by case.
And just a comment real quick on that, I think there are benefits of both. As Brandon said, look at them case by case. Be careful about how the data formats are stored, right? Because you certainly at least don't want to lose the fidelity and value of the images.
Agreed.
Very good. Andy, I want to follow up with you on a point that Brandon made. He was talking about starting with the data migration and making sure the data is clean. You made the point that that's something that needs to be cleaned up. So if you had wanted to get everything clean at the beginning, would you have been able to get even started? Just what are your thoughts on that order, chicken and egg type thing, about cleaning up the data in light of relative to the VNA?
I'd ask Brandon some questions about that, because I don't. And the thing about not all VNAs are created equal. Let me just ask Brandon: are you talking about VNA vendors and products, or are you talking about the way an institution chooses to use that technology?
I would actually say both, Andy. I mean, obviously, vendors have their differences in terms of what they call a VNA. I mean, there are VNAs out there in the market that really are, I mean, for all intents and purposes, are just DICOM archives, just repackaged. But Then there's some that have some very advanced features, and I like to say that most vendors are getting to the point where the VNA is becoming more and more advanced. In terms of from an organizational standpoint, I think, and I know this is probably something we're going to tackle in some other questions, but the VNA is something that's not necessarily well understood in terms of all the feature functionalities it has. A lot of times it's seen as just a consolidation method, or seen as something to image enable your EHR. But there's much more beyond that that a VNA is capable of. And I think that my point earlier with regard to cleaning the data before putting it in the VNA, that just makes things easier. It's not necessarily the way things go, but if you have the time and you have the capability, I absolutely recommend you clean it before you put it in the VNA, and then maintain a policy and practice to keep that efficacy of data.
Well, and I think we could all agree that that's a good principle for any new system, right? That whatever data you put in there, you'd like to do your best effort to make sure it's clean beforehand. I think, and like you said, I mean, my limited exposure to other sites that are using VNA, I find that what we're doing and what they're doing isn't necessarily the same thing. We use the VNA as, well, until recently, we used it as all non-radiology imaging. A lot of folks are using it for an archive for their radiology, or for their PACS, or perhaps a deep archive for their PACS. And that is its principal role. Some people are using it as an aggregation point for multiple institutions that they have either acquired or represent their total organization. So I think people's use of it can vary quite a lot. And obviously, if you've got data out there that needs to go into the VNA in advance, then migration and data cleanliness makes a lot of sense. For us, it wasn't like that because we were basically acquiring brand new data that was coming directly from modalities. And so data quality for us is really about how do we understand what we need to capture for billing compliance and to make it clinically useful. And then what can we expect users to do, and how much can we use the VNA and the tools that come with that to help with the process of capturing and acquiring and cleaning the data that we get. So that's kind of how we looked at those things.
All right, very good. Andy, let's stick with you on this. A little more about interoperability. How does this work support your organization's interoperability with current modalities and departments?
I'm not sure what that question means exactly. I guess it's. I'm sorry. I guess are we talking about basically sharing imaging between departments? Is that what we're talking about here?
Correct.
Okay. Well, I think first of all, without it, that was difficult to do, with the exception of the PACS imaging, which obviously is being consumed by basically everybody. The imaging outside of that, including cardiology, which is obviously a big producer of imaging data and of interest to many departments, was difficult to see. Having a VNA really isn't enough. You really have to have enterprise imaging platform, which includes universal viewers, EMR integration, some standards, and a lot of other things to really be in place to do it well. But once you have that figured out, then making imaging available broadly to everybody who might want to consume it is incredibly powerful. But it's also interesting to me of how people don't really know what they want or recognize that that's a need that they have. Sometimes they're the ones producing the imaging and they don't think anybody else wants to see it. Sometimes they are ultimately going to be a consumer of information from other departments and they don't think they're interested. But then once it's up and they see it, they go, oh, you know what, that's actually really helpful for me. So it's kind of fun to watch the process of discovery that everybody's going through as this technology takes root.
Okay. Somebody want to jump in there?
Yeah, just a comment. So I think Andy's spot on with respect to the discovery of the value of the information as new data starts being collected. I think a good example that is taking more and more hold is the use of visible light. And just to touch on the XDS for a brief moment, it's one of those standards that Andy or maybe it was Brandon made a comment about, right? The standards compliance, and we refer to IHE as sort of the standards engine these days, where they're making sure that all of these communication methodologies are compliant across vendors. They provide the standard sets. Is a really good way to make sure that you're future-proofing when you deploy that VNA, right? Because HL7 and DICOM are standard modality communication methodologies, but that visible light that is taking hold, that I think Andy you're experiencing at UW, it is a really valuable tool that everybody is sort of going, oh yeah, that does give me a really good look into a more complete patient record, and I think it's lending itself to better clinical practices and I think improving that patient experience. I also think it's also addressing the clinician experience, right? Because they're not having to go searching for data that might be relevant in a particular patient case.
Very good. Thank you. All right, next question. Let's start with Brandon on this one. And this would be, does the VNA future-proof an enterprise imaging strategy? Do you think it does that, Brandon?
Yes and no. I think it can. It can if done appropriately. I think it can also be an anchor. And let me qualify that. If appropriately done, if following an appropriate strategy in terms of acquiring a VNA that meets your organization's needs, and understanding what your strategic direction of your organization is, then absolutely, I think that's possible. I think the VNA has a lot of future iterations that are still to come, especially with AI, the analytics piece. There's a lot of functionality that I feel like has not really been tapped into. Now, when I say no, there are some strategies out there. There are some business cases in which organizations need to be quick and nimble, and maybe a VNA is not necessarily the best approach. When it comes to consolidation and even what we call federation of data, sometimes a VNA shouldn't be the first choice. Maybe a VNA is appropriate down the road, but maybe you need an enterprise viewer that has the ability to federate the data that exists in your disparate archives, especially when time is not on your side. So you have a lot of organizations that go forward with a VNA endeavor, and they want it stood up and ready to go in 6 months. That can be a complicated thing depending on the size of the organization, the volumes, thinking about data migration, because until you have data migration, you're really kind of stuck, and that might be a kill point for you. So just to that question, again, I don't mean to give indecisive answers, but depending on the situation, it could be yes or no.
Excellent. Aaron?
Yeah, I think that this goes to something Andy talked about, right? Is the planning and that they didn't quite know, but take a lesson from the beats of your peers that are out there. I'm sure Andy and Brandon are happy to talk more on this, but you all out there in the audience, you all know people that have deployed a VNA or are in the midst of deploying a VNA, and if that's something that your organization is thinking about, start planning far in advance. What that does is alleviate some of those concerns that Brandon has voiced, and helps you get to that consolidated view that you want in a timely fashion that works for your enterprise imaging strategy, right? It's about planning ahead while the technological elements of a VNA can help future-proof, like we talked about here and in the previous question. Making sure that you have the time to do it, as Brandon says so well, is really a critical component.
Andy, you feel like you're working on some future-proofing over there?
You know, we found that the VNA is kind of the Swiss Army knife of the imaging space. It just seems like many times when we have a problem, it offers a solution. We originally saw it as a way to park ultrasounds that nobody knew what to do with. This visible light opportunities came from sports medicine and at the burn center, and we were able to take care of them and offer them a solution. The arthroscopy folks had a problem with their imaging, and they actually have a means to DICOM wrap their images, which is handy, and so we're able to ingest their stuff. We recently consolidated our packs with another institution, and the VNA offered us a way to archive those images and make it easier to make that transition. So, you know, it's just turned out to be a really helpful thing because our packs and perhaps other pack systems, I don't really know, but is proprietary in terms of the way it stores the cached data. The deep archive is truly DICOM, but the cached archive is not. And it makes it perform better, but it also makes it less flexible and less open. So the VNA is a more open thing by its nature, and by complying with IAT principles, it makes it a lot easier for us to plug and play with other technologies that come along. So yeah, I think it actually does future-proof us to a great extent.
All right, very good. Next question. Is the industry facing a resource crisis across the U.S. for IT imaging resources? Andy, do you think so, and how does it affect your organization?
I think that's a well-known fact that it's difficult to find highly educated, highly skilled people, particularly in IT. And then if you specify IT people with imaging experience, you know, you can count on one hand. We have been able to find people that are already in the business and retain them, recruit them and retain them. But I would say roughly half of my team at this point did not have a lot of experience specific to the challenge. We just try to find people that we believe will be outstanding employees that hopefully have some related experience that suggests that they would be successful in doing what we do, and then have a desire and ability to learn new things. And, you know, that's really worked out well for us, but it does imply a lot of training time and a little bit of patience because you've got to wait for them to come to speed. But yeah, there's no doubt about it. We're trying to find somebody right now, in fact, and it's just really tough out there to find good people.
And Andy, retention, is the training helps with retention? You're sort of investing in them, and I would imagine pay is obviously important. And any other tips on retention?
I don't think the training really is a way to retain them. In fact, if anything, it might be another way, because if you're making them more valuable, then all of a sudden the more interesting
So don't train them. Is that the point?
Well,
I'm just kidding.
Don't make them attractive to anybody else. They'll steal them from you. No,
right.
I think it's no different than any other organization. The way to retain good people is to treat them well and provide them with meaningful work and reasonable compensation, and it's just regular stuff. Nothing different.
How about you, Brandon? Do you see it out there in the service world?
Absolutely. I mean, I couldn't agree with Andy more. It kind of his point. You really need to start with capable individuals and kind of build them up. I mean, sometimes you get lucky and you find somebody that's very capable, and usually, Andy probably may or may not know about this, but you feel like you're poaching from other organizations in order to find your next capable person for an enterprise imaging endeavor, which you don't want to do. We don't like to poach from our neighbors, but really production of an effective training program is the way to kind of build up your resources within your organization. Of course, that is a huge investment. And in order to actually create that program, you have to actually dedicate the time and have the resources capable of putting a program like that together. So there's some chicken before the egg items there as well.
I just maybe add to that too, Brandon. I think that most IT people I know, their access to training is a key issue for them. If you deny them the means to learn things they need to know or want to know, that's a good way to dissatisfy them and get them to leave. So I think it's a really important thing.
Aaron, I would imagine things are quite the same on the vendor side, right? No reason to think they're different over there.
Excuse me, yes. Pardon me. Yes, that's absolutely right, Anthony. We have the task of being flexible enough to respond to the needs of lots of different kinds of IT organizations and their different environments. And so retaining people that are flexible, thoughtful, and creative in how we address those variables is of course challenging. So I think we have a truly talented group of deployment services and pre-sales IT folks, and I think they do a great job in evaluating that. And we train and we provide opportunities for growth and learning and professional and career growth, of course, as well. So, like Andy and Brandon said, that's the way to retain and improve.
Very good. All right, Brandon, let's start with you on this. A little bit more about the future. Where does next generation AI and business intelligence play a role? We hear a lot of that around imaging.
Oh, I definitely think it's right now it's the hot topic. I mean, we talk about AI and artificial intelligence as well as business intelligence, but I think we're still kind of in infantile stages here. Unless you're a research organization, probably haven't had a lot of exposure firsthand with regard to AI. At least that's what I'm seeing right now out in the field. In terms of setting yourself up appropriately for AI, I think we kind of need to take a step back, and this is probably a controversial thought process, but the reason being is there are still a lot of organizations struggling with the basics. I think a lot of radiologists are pushing because they see the value in AI, and then there's others that are pushing back on it, not wanting it for fears that may or may not be factual. In terms of AI and preparing your organization for it, I think VNA is definitely a good factor because it allows you to have a centralized repository in which to build off those algorithms and ensure you're working off of one data set versus having a bunch of disparate data sets to try to chase around. In terms of envision for the next generation of VNA, or am I jumping ahead here?
No, go ahead. Go ahead. That's fine.
I'm reading as I go along here.
You're doing good.
In terms of envisioning the next generation of VNA, I guess the question is for AI. There's some VNAs they'll actually archive on pixel level, and I'm wondering in terms of those algorithms with AI, if they're actually looking at the pixel level, if they're scanning the image. Depending on the algorithm, it could be one or the other. But in terms of the VNA, I think there's going to be an ask of it to do even more to feed the AI algorithms appropriately. So I could see the VNA expanding into being the centralized repository of everything, not just imaging data, but why not use it as your central hub for your entire healthcare organization? So I could see that happening. I don't see any movement towards that right now, but it definitely would be probably beneficial in terms of consolidation at some point.
Very good. Aaron?
Well, so Brandon stole my thunder there. No,
Sorry.
No problem. Of course, it was a great answer, Brandon. So look, in terms of next generation AI and business intelligence, obviously, there's a lot of hype around that right now, and I think there are stages to that. We're in the I'm going to call it phase 2 of AI development. There was the huge flux of startups that have sort of gone by the wayside. We're seeing some of the ones that are able to start delivering on their promises succeeding. Obviously, GE Healthcare has a large effort around Edison and the business intelligence and future artificial intelligence comments there. And you can see lots of our content out there on the web if you want to learn about it. In terms of next generation of VNA, I think there's a couple of things that are very interesting, right? It's about infrastructure. It's about cloud. It's about having a really flexible visualization layer that provides a unique experience to each type of end user. And as Brandon said, I think that it's really interesting to think about not just imaging data, but all of your ontologies, right? Sensor data, wearables, et cetera, things that are patient and clinically related that may not have a home today. And so I think that's a very interesting thing as well.
All right, very good. Andy, any thoughts on what these gentlemen have just said?
Well, it's a good thing that Brandon and Aaron are here because they are both way more visionary than I am. I guess the challenges I see right that are in front of me are so vast. I'm trying to envision the current state of VNA, let alone the future state of VNA. But clearly, to get usable business intelligence out of it, we have to do a whole lot more with standardizing data, with following standards, adhering to HIE principles, and just really move in that direction because there's just so much to do. I mean, just something as simple as identifying a body part, not only in DICOM radiology studies, but in all studies, so that if there's say a visible light image of a hand, a burned hand or something, that you can note that there's also an X-ray image of that same hand for that same patient. So by virtue of the fact that the body part matches, just things like that today aren't being adhered to. So there's just so much to do. I think I like the idea of trying to encourage the use and spread of capturing images centrally in the VNA and making them available to people, and trying to inject that available imagery into their regular workflows, so that I think part of the problem is not that doctors are looking for information and they can't find it. The problem is they don't know it exists at all and don't think to go searching around. But if it did exist, and if it was available to them, if it was right under their nose, they'll probably use it in their planning and their diagnosis. So I think it's I just can't wait to see where this goes in terms of making that information available to them and trying to do it as intelligently as possible, and then seeing what that does in terms of improving healthcare.
All right, very good. I want to get an audience, we don't have too much time left, but I want to get an audience question in here. So let me throw it out there. How long have you kept legacy data from other ologies? How much do you recommend migrating into the VNA so that we can collapse the legacy archive and recognize the savings of one system versus multiple archives? Andy, why don't we start with you? Your thoughts around that?
Well, I think everybody was a little worried about what the storage requirements were going to be for VNA. Compared to radiology, it's nothing. It's tiny at this point. So I'm not too concerned about having a retention policy. Generally speaking, we have a retention policy at UW Medicine of 10 years, with the exception of pediatrics. And I think what I would propose, and again, we don't have a good governance group, so there's no one to take this to, but I think that the policy will probably hold up to VNA storage exams as well as radiology exams.
Okay, Brandon, any thoughts on that question?
Yeah, the subject comes up a lot, every organization addresses it, but I would say almost always no one actually sloughs off any data. They end up retaining everything. Now maybe they use the VNA's image lifecycle management capabilities to move it off to cheaper storage if they have it, where they move it off to disk and maybe the rest of the archives using SSD. But I really don't see any movement towards deleting items. Sometimes I've seen organizations not migrate out of a legacy system, certain exams, only because that data is dirty and really wouldn't serve any purpose anyways. That's typically what I'm seeing at this point. So I think there's still questions on the legal aspects that create some complications that prevent organizations from acting upon removal of any data. Plus there's implications later for AI. Maybe they want, for research purposes, want to retain the historical images that may provide value in the future.
What we see in terms of retention, this has been a hot debate here for probably about the last 7 years, and the two groups that argue for keeping things basically forever are the researchers, and also there are some clinical areas that feel very strongly that keeping imaging over 10 years is very important to them. The administrative side of the house is on the side of getting rid of it, because if it's no longer clinically interesting, it becomes a legal liability more than an asset. Yep. So we actually have that policy in place, but like I said, we haven't actually deleted that data yet. And I actually do know a couple places, and I'm sorry I don't know the names, I wouldn't say what they were anyway, but there's a couple places I know of that are actively deleting data. Or, as you said, Brandon, I've heard of in a couple of instances when somebody did a migration from one PACS to another, they left out anything older than 7 years, but didn't talk about it a lot. It seems like it was done sort of almost in a sly way. So, but we've also seen, we've run stats on access to exams over year over year, and what we see is after about year 5, people rarely ever look at those images anymore. So the value to them is questionable.
All right, I want to get in 2 more quick questions. Aaron, let me go to you on this one. Is there a logical order to the departmental progression for enterprise VNA expansion? Any thoughts on that?
Yeah, so absolutely. I mean, look, I think we talked about this a little bit, but it's about your planning and what your enterprise imaging strategy will be. I've taken to sort of thinking about this in terms of your enterprise data management and how you want to capture and store that data. So this actually relates a little bit to the last question too. What's the most important to you? What gets accessed the most? What's the easiest data to migrate and absorb and manage quickly? I think that it's about figuring out which is critical and which is phase 2 and phase 3, or if you want to go big bang. It's really about the planning and governance process, and then also the participation of your stakeholders. It's a bunch of things that have been commented on before, but lumped into this sort of larger planning process.
All right, very good. We have one more question from the audience that I want to get everyone to weigh in on quickly, and then we will let everybody go. So, Brandon, let's start with you. Of course, what would life be without finishing with a blockchain question? Do you envision blockchain becoming a truly potential future of VNA or enterprise imaging?
I think it's definitely going to have its place in healthcare. I mean, that's already seen. But in terms of VNA, I don't know that answer. We'll see. But I would guess that yes, we're going to see all of the latest technology move in, especially for secure data, audit trails, et cetera. I see many advantages there, but not something that, to be honest, not something that I've been thinking about recently with regard specifically to DNA.
All right. Andy, has blockchain crossed your mind?
Not at all.
Let's keep it that way, right?
Yep. No, I don't know. When it comes up, then I guess I'll deal with it then. But at this point, it's a little hard for me to put those two things together, to be honest with you.
Enough on your plate, right? Aaron, you guys at GE talking about blockchain at all?
Well, I probably won't give away the cow for free here, Anthony. But you know, the shortest answer is that it's an interesting technology, right? And there's valuable security components of it. There's valuable auditing capabilities there, and you know, I'm sure like every other technology user and vendor out there in the world, we're evaluating its value both to VNA and you know, other pieces of technology. It's one of those things that's sort of like AI, right? It's right on the fringe of burgeoning, and it could go either way.
Very good. Well, that is about all we had time for today. What a great conversation. Lots of stuff to cover and a very fascinating topic that a lot of people are grappling with. So thank you so much for that. Regarding continuing education, those of you who hold the CHIME CHCIO certification, attending our webinars gets you 1 CEU. If you need a certificate of attendance for another CEU program, use the final slide in this deck. You'll get an email when an archive recording has been posted to our YouTube channel of this event. If you want to sponsor a webinar on the topic of your choice, you can reach out to Nancy Wilcox from our team. And you can go to our website to view our upcoming schedule of webinars. So with that, I want to thank our panel very much, Andy Strickland, Brandon Taggart, and Aaron Hillman. And I want to thank GE Healthcare for sponsoring this event. And I want to thank you, our attendees, for joining. So with that, everybody have a wonderful day. Thank you.